Monday, our Courtney Yoon covered the topic of medical gaslighting, the idea that people walk out of their doctor's office feeling unheard, dismissed, or ignored. 9 News medical expert Dr. Kohli is here now to talk about this issue this morning. So the first question, when we were talking about this yesterday, I think a lot of our viewers know about gaslighting, but it's often used to describe a personal relationship when someone is really being toxic towards you.
Yeah.
Medical gaslighting, a little different.
Very different. In fact, the gaslighting, the term came from this 1938 British play. It was fascinating. It was a guy who wanted his wife's inheritance. So he tried to convince her that she was going insane by making her believe that everything she said was not true, was an alternate reality. So very, very toxic, manipulative sort of incentive. Medical gaslighting is when the doctor or provider dismisses you without proper evaluation, but not necessarily manipulative, usually not toxic. It's usually due to the fact that they either don't know that they're supposed to look harder, they have some bias coming into it, or this idea of what's called medical paternalism, doctor knows best. So a lot of, especially older doctors, have that sort of view towards medicine that they may know more than the patient does about their symptoms.
Interesting. So why does this happen, and how is the patient impacted by it?
So it happens for a number of different reasons. And like I said, most of them are not intentionally meant to hurt the patient. One of the biggest reasons, really honestly, is time pressure in the clinic. So doctors are seeing patients every 10 to 15 minutes, sometimes even less than that, and they've got to move. So they come in with their own biases. They bring their baggage to the visit, right? That's called implicit bias. So for example, you're seeing an older person who has chronic pain. Oh, well, that's just aging, right? That's your implicit bias about older people having more kind of chronic pain issues, and that's what you bring to the visit. So it could be they're short on time. It could be their implicit bias. It could be that they don't know. So complicated condition like lupus, for example, or chronic Lyme can present with a whole host of different types of symptoms that you might miss. And in medical school, we're taught when you hear hoofbeats, you think horses, not zebras. So if it's a very rare disease, that's possible that someone could also miss that, right? Just because of the limits of their knowledge. And so a sign that you might be being gaslit is if you walk in with your complaints and you're being frequently interrupted, so they're not letting you finish your story. If they don't do a proper medical evaluation based on your symptoms. Now, every symptom doesn't need a medical evaluation. For example, someone comes in because they saw blood, made them nervous, they passed out. That's a reflex. That's a normal reflex. So by medical literature, we're not supposed to do any tests for that. That's called the vasovagal response. But if it's something that's persistent or something that hasn't deserved workup and they haven't explained it to you, then that means you're being gaslit.
I'm going to ask who is most affected by this, and I don't mean the patient. That's an easy answer to that question. But I mean, is there a group of people that are most often gaslit?
Many groups of people, women especially. So women are hysterical, right? That's the idea that everybody has. And so a woman comes in with palpitations, it's just stress. You're just being hysterical. Or she comes in with other somatic symptoms like fatigue or abdominal pain, constipation, diarrhea. It's all just related to stress. So we see this often in women. African American patients are more likely to have their symptoms dismissed or to be thought their symptoms are coming from secondary gain. And that means they're trying to get something out of it. Disability or trying to get a payout from, their work or something like that. So they often get dismissed. Elderly patients, as I mentioned, and people who have rare diseases. And this can be a real problem because you can imagine these are big groups of people, right? Women make up 50% of the population are elderly patients. Your symptoms are dismissed. It can lead to delayed diagnosis. It can lead to a lot of psychological distress, and it can lead to worsening of the condition because it's not getting appropriate treatment.
I feel like when Dr. Kohli said women are hysterical, you looked at me to see if I would react to that. Let the record show I did not nod. I just sat there and looked.
You did.
No, in fact, you made it look like you didn't agree, right?
Not agree with this. Yes. Thank you.
How can we distinguish between gaslighting and from appropriate reassurances by the doctor?
So this is really important because every time the doctor doesn't agree with you, you are not being gaslit. So I don't want people to walk out of here saying, if I didn't get the answer that I want, this is gaslighting. So you need to ask yourself, did they do appropriate medical workup? Did they listen, and did they do an appropriate medical workup? And you need to ask them their explanations for what their conclusion is. So for example, if a woman walks into my office with palpitations or heart skipping, it's probably nothing. You're young, you're healthy. It's probably the fact that you're stressed out, mom. That's gaslighting. But if a woman comes into my office with palpitations, I do an echocardiogram, which is an ultrasound of her heart. I put a heart monitor on her, and I see the skips are the benign type of skips. Then I say, it's nothing, work on stress and sleep and hydration. That's not medical gaslighting. That's giving an appropriate opinion. So really what workup they've done, how well they've listened, and then whether or not your symptoms are being addressed if they're still persistent.
We probably have less than 30 seconds at this point, Dr. Kohli. Anything else you want to say about this topic of medical gaslighting?
You know, I would just say that you are your own best advocate. It's not intentional, but it does happen. It happens every day in our clinics. We recognize it as a problem. So you need to get a second opinion if you think you've been gaslit. And here's what I would say about your second opinion. Don't take your first opinion to the second opinion. Because the minute you bring in a diagnosis from another doctor, and patients do this to me all the time, they say the last doctor said it was this, it already creates implicit bias, right? Because it's already conditioned my mind to come in looking a certain way. So try to start with a blank slate, but don't go doctor shopping. Don't go to 10 different doctors until you find the one that's giving you the right answer, because you're more likely to get yourself in trouble.
Very interesting this morning, Dr. Kohli. Appreciate it.